Hi, everyone. Welcome to a new episode of Parenting and You with me, Dr. Shefali. What do you do as a parent when all your fantasies about how you would be as a parent or how your children would turn out do not come to fruition? When all your fantasies crash around you? When you don't understand how your children are behaving, you think they're inappropriate or you think they're being quote unquote bad? Or maybe they do have substance abuse issues or other mental health issues. How do you cope with the disappointment? How do you cope with your expectations not being met? Well, it is not easy. It is difficult to calibrate your fantasies versus your expectations. But there is a conscious way to cope. And that's what this episode is all about. Coming up next, a mother who is desperate to help her 5-year-old son with his inappropriate behaviors. Joining me now is Angela. She's struggling with her 5-year-old son's inappropriate behavior. Hi, Angela. Tell us what's going on.
Hi, Dr. Shefali. Thank you for having me here. So, yes, my son, more than like really behavior, like physical, is more his words. Sometimes when he says things are a little bit aggressive or sometimes in another nature, kind of inappropriate, I don't know exactly how to help him. For example, either this morning or yesterday, he had a pencil and he said, "Mommy, is this very sharpened?" I say, "Yes." He said, "Okay, great. So I can stick it in your face." I mean, it might be plain, but there are so many things like that. And I recognize it's part of my anxiety that is like, I don't want to have an aggressive kid, right? Like, I don't like all these things that come to mind in a second. I know he's a boy, he's, healthy and has a lot of energy, but how to help him besides redirecting him, like, I don't know if it's a better way.
So what do you do instead? What do you say to him when these things happen?
Well, I usually tell him, I said, well, that's not a very nice thing to say. And how will mommy feel if you do that? I wouldn't feel so good, right? Would you like if mommy or anybody does that to you? Say no. I say, okay, so we don't do those things to other people. Like, I kind of usually do those things, but I do feel like I don't know sometimes how to say it. Oh, can I give you another example?
Yes, yes.
So I am very open with him and my body and everything. Like we're close, and I was actually sometimes taking a bath with him until not too long ago. He's 5. And the other day he saw my breast and he said, "Mommy, oh, why are you having sausages coming out of your chest?" And I say, "Well, they're not sausages, the name is nipples." And then he wanted to grab him. "Okay, mommy, I'm gonna, like he's kind of like silly, but I said, it's mommy's body. We're learning how to respect everybody else's body." And then, he's okay. He tries again and again, but he's okay. But I do feel anxiety about it also because my husband is a little more, I guess, strict, right? So it's like me between letting my son be himself, like expressing and being, and how to be more appropriate and respectful.
I'm not hearing anything inappropriate yet, so I'm waiting for something more inappropriate. Now, is he inappropriate at school?
No. He's not. That's the thing. And I'm glad he's not inappropriate anywhere else. But and I'm glad that he does it here with us. There are some things that are very descriptive. How he says it, I don't know if I should say it, but like he says, "Oh, I'm gonna throw this rock and I'm gonna break all the windows at school." And I know maybe this is normal, but I'm here because I obviously I am the one that needs the help knowing, okay, is it normal or not?
Right, but help me understand. So he says these things, but is he showing the anger with it? Is he showing a lot of disturbed emotion with it?
Typically, no.
So he's saying it like just casually, when I go to school, I'm going to break the windows?
Yes, but sometimes he does get upset when I don't let him do something, or when it's, I tell him no. And he says, "Oh, like the things that kids say, I hate my mom," whatever. Like, and I'm okay with that. I really am. I don't think he really acts on the anger so much. Sometimes he does grab his face, like his head. He's like, "Oh, my mind is telling me to do bad things, but I don't want to. How can I stop my mind?" Right?
Well, I think a lot of it seems normal to me, but I can understand your anxieties. But instead of feeding your anxieties, maybe you can just, lovingly, playfully interact with him. So if he says, "I'm going to poke your eyes with this pencil," then instead of going, we don't do bad things like that. We don't talk like that. Instead of going into that place, you can go, what? You're going to do what? You're going to poke my eyes? And then how will mommy see? And how will mommy love you? And how will mommy kiss you? Oh my goodness. And then you'll have to take me to the hospital. And then what'll happen, right? You can go along with that fantasy in a joking way and show him through the fantasy how ridiculous what he's saying is. You see what I'm saying?
Gotcha. Yes.
Or if he says, oh, I'm going to take this rock and break all the windows at school, you can say, oh, and then what'll happen, right? You can go with the story. And then he'll say, and then I'm going to get into trouble. And then you're going to say, then the principal is going to tell you that you can't come back to school. Like you can just go with the story. Why am I saying this? Children are very imaginative at this age, and they are expressing all sorts of fantasies of fighting with dragons and slaying other people and being on a battlefield and going to the top of the mountain and flying. They have no awareness of the difference between fantasy and reality right now. So instead of shaming him or telling him he can't touch your body, when he was trying to touch your body, he was doing it out of love.
Yes.
He wasn't doing it out of being a male touching a female.
No.
Your mind went there.
Yes, but it's not so much me. I feel like because of my husband. Meaning like I don't mind. And I know he's 5 now, not 2 anymore, rather 3. I get that. But that's why I'm like, I don't want to shame it. I don't want to make it look bad or feel bad. I don't. But then my husband sees it, or he's right there. Then he gets upset at him and he's like, oh, what are you doing? So I feel like I'm in the middle, and I know I cannot focus on my husband, but I feel in the middle and I don't know how to act then.
Yes, maybe your husband doesn't realize that 5-year-old boys or girls are very much in their fantasy, that they're touching mommy's body or daddy's body out of curiosity, out of playfulness, out of silliness. They're not touching it. He's not touching your body because he's a boy. He's just touching your body because he's your kid.
Correct.
And he's just realizing, oh my goodness, your body is different than mine, and your body is a little strange and it has these things that I don't have. Your husband may not realize that your child is innocent and is just being silly or expressive or in their fantasy. And he's taking things very literally. This is a problem between men and children. Children are very figurative. Children are abstract. Children are fantastical. But men are more literal and more logical and more reasoning, and they can't understand children, the world of children. So yes, you are in between your husband and your child because you have the capacity to understand your child and understand your husband. And your husband is coming from a logical space of rules and, rationality and, very, very clear, linear way of thinking. Children are circular, abstract, a dream world, illogical, irrational, emotional. And so women typically can understand children better because we also have that abstract way of thinking and that more emotional way of thinking. Not the irrational. We're not irrational like children, but we do have that emotional way of connecting with people. And so we can understand children. But you're getting afraid and labeling your child as inappropriate. But I'm not really hearing anything inappropriate yet.
Well, there are things that are a little graphic, and I'm not sure. Like one time, but this was actually even like 2 years ago. I'm gonna tell you, like he said, oh, he got upset, and he's like, "Mommy, I'm gonna take your eyes out, and I'm gonna do this, and that, all these things." I don't know. I just didn't think that was like appropriate for like 3-year-old.
Is he showing any violence to animals and people?
No. Well, to animals in his fantasies, like he likes toys like guns, and he's like trying to shoot things, but we say we don't like guns actually, or we like, let's not shoot like animal. Well, not he's doing it obviously, but like not pretend to do that. How about we pretend to do another thing, and then we kind of do our things.
You give him a gun, he's going to pretend to be violent. So you're giving him a gun,
We don't have to give him a gun.
Exactly.
He makes it.
He makes it. Yeah.
He can get 2 pencils and like he makes it.
Well, part of it is that he's a boy, but you can keep watching him. But I don't really think you need to be worried that your kid is going to be a psychopath, right?
Yeah. One other question, doctor, really quick. So he loves to smell me. Okay, fine. But sometimes he kind of really likes to go under my armpit. And I'm like, okay, for like a second, okay, I get it. Like, mommy, I am very cuddly. Like, I am very affectionate. Okay. But then, like, feel like he likes to kind of, if he could stay there. And I'm like, I don't know how to redirect that.
But again, if it was a girl, would you feel it was inappropriate?
Kind of, because it's just not like a little smelling mommy. It's like sticking the nose in there. Like, it's weird.
You don't realize how weird kids are. I think you are expecting logic and sense and, a very neat package. And children are wackadoodle. They're kind of nutty and they're completely irrational and illogical. And they find the most silly things funny, and they find humor in ridiculous things that you and I would never find humor in farts and burps and silliness like that. And, they get great pleasure out of these things. But I think it's just a phase. And I would wait before I would get really worried and label him in any way. We're so afraid as parents that our children will be weird or not accepted by culture, or, we sometimes feel like only our child is the weirdest child or the child who's acting so strange. But most of it is our own anxiety. For the most part, our kids are okay. They are in the bell curve. They are average and they will be fine. But we are extra controlling and perfectionistic. So I would just wait. I'm not saying you're not right, but I think it's too early.
Correct.
I'm not hearing anything so inappropriate.
Yeah, I don't want to label him. I really don't want to label him. And there are just a few things and he's great everywhere else in school. And like, he's great. Nobody ever say anything. It's just here and I'm glad that it's with me because he feels comfortable.
Yes.
I get it. I'm glad. It's just really my anxiety because I felt like maybe I don't know how to do it better. Maybe I can, do it better, but like a storytelling and kind of ending the story in a different way is very helpful. And I can definitely do that.
Well, if you are going to think of him subconsciously as weird or something is wrong, then you're going to take him very seriously. But if you realize he's just a silly, naughty, wacky kid, then you'll just go along with his story. You'd be like, and then what you're going to do? And then what are you going to do? And see how the story ends. And just go along with it and show him, I'm not worried because you're an amazing kid and you're going to be fine. But when you start acting worried, like, why are you asking me? Why are you talking like this? What do you mean? Now you're giving him a weight that is not necessary.
I think I really have to stay more like, he's okay. Everything is good. Let's just kind of go with the flow. It's sometimes a little hard, but I can do that.
Yeah, this is the world of boys and young boys. They're very, very silly and very imaginative, and girls. And you just need to go with the flow for now. And unless you have other indicators, I would resist labeling. This is what's happening to you. You're labeling your kid because you're anxious and you're so nervous that he's not going to be okay that you're actually creating a problem when there's no problem.
Yeah, I think you're right. Thank you.
Enjoy him. He's funny. He's silly.
Yes. And he's 5 and he's close to me. Like, I do want him to be close to me. I want him to come and tell me everything in the world, right?
Yes.
So like, I get that. It's just that other part of me that sometimes gets extra anxious and it's like, wait a minute.
Don't overthink it. I wouldn't overthink it too much.
Okay.
Thank you so much for joining us.
Thank you.
It's so hard when we parents observe something in our children that we don't understand, that we don't relate to, that is unexpected. It triggers us. And the first place we go when we're triggered is to a place of fear and panic, which then leads us to judgment. And our judgments inevitably create these labels. We label our children good or bad, or in this case, as you saw, she was labeling her child inappropriate. And sometimes it's not even that our child is good or bad or appropriate or inappropriate. It's just that we are unable to grapple with it, or we are unable to understand it. So before we jump to labels and judgments of our children, let's take a step back, consult with some coaches or experts, because sometimes what our children are going through may be completely normal, but because we are unaware of it, or we are, finding it hard to grapple with, we superimpose our judgments, presumptions, and labels onto our children. Labels can damage our children's sense of worth. So before we slap on a label, let's be very careful to examine if we are accurate, if it is the right label for our children, and truly explore if our fears and our anxieties are clouding our own ability to connect with our children. Coming up next, a mother who wants to know how to be the best parent she can be to her 2 adult children who have serious addiction issues. Now we're going to meet with Beth. She's a mother of 2 adult twins who have battled addiction issues most of their lives. Beth wants to know how she can be the best parent to her adult children. Hi, Beth. Welcome. Thank you for being here. Tell us a little bit about your struggle.
My children are both 30 right now, 2 sons. So I'm curious about, I have one main sort of question that I'd love affirmation on. Essentially, did I do the right thing? And that it also might benefit parents who are in my shoes now, where I was about 8 years ago.
So tell us what you're dealing with exactly.
Yeah. So when my sons were about 16, they started a lot of alcohol and marijuana use. And it was pretty clear that it was really starting to affect their development, their behavior. They were really starting to change. And it only continued to get worse, including with other drugs, opioids and benzodiazepines. And I hardly could recognize them. It was, really isn't it every parent's one of their worst fears, if not, one of them. Just full of heartache. And I want to respect their privacy a bit here, but, run the movie, somebody who's in addiction and all that can include criminal charges, police in the night, phone calls, homelessness, wondering where they are, if they have a roof, if they have food, seeing them looking so unwell, underweight, run that movie. That's what I've experienced. It's a lot of heartache. At the same time, as many difficulties in life can be, there's also a way that I almost want to say I wouldn't trade it, for the gifts of my own maturation and development. So there have been some gifts in it as well.
Well, first, I want to say thank you for sharing. And I can only imagine, so I won't even pretend. And I feel your struggle. I feel the pain I see on your face and all you've been through, but also I can see your courage because you've obviously alchemized all the struggle, and I'm sure you use it to help so many in your life as you're a coach as well. So that is incredible. How can I specifically help you today?
Okay. So my main question has to do, generally with support, right? Between disempowering our children and overpowering them at any age, such that we might be enabling them, specifically where addiction comes in and it starts to make somebody so unwell. And it also, when it starts young, really impedes their development. It's almost like it froze much earlier. So around, if I were, so my sons are both 30 now, but you developmentally in kind of a maturation age, it's like 17. So when one of my sons was 22, it became unbearable to live with him. And I kicked him out. Property destruction. Like I said, I want to kind of keep a little bit of privacy, but it was untenable for me.
Yes.
And even though he had this chronological age, it still remains in me this kind of question, was it bad parenting or even inhumane treatment of somebody when they're so unwell? And then there was also what I was experiencing, just untenable. I could go into great detail, but I'm a top cookie. I've even worked with youth in Department of Children and Families here. I was a public school teacher for 26 years.
So is your question about the past or about something that's happening now?
Yes, so both. So in the past, when I asked this 22-year-old who wasn't that capable of living on his own because he was so unwell, should I have stuck it out, knowing that he was so unwell, not knowing where he might be housed, what he could do? Should I have stuck it out in the way that you might do with somebody with a medical injury, or like we do with our newborns, right? We're tired, but we still get up and go, our cells be damned. It's that question, did I do the right thing? Was there a better way I could have done it? And in my heart, I feel like there was nothing else I could have done.
So this was 8 years ago, but it's still plaguing you.
So one of my sons has recovered a bit and he's now on his own. My question's mainly about the past. So he was 22 when I kicked him out and now he's 30.
Yes. But are you in touch with him or are you?
Yeah, I've kept some touch with him over the years and he had a try at living with me again. It didn't work at all. It was even worse than the time before. I'm not in touch with him right now, but I don't expect it to be permanent.
Okay.
Trying to get back up on my feet again.
Do you think he's still an addict and not recovered yet?
Yes.
Okay. Are the twins in touch with each other?
Yes.
Do you have a good relationship with the other twin?
I do. When there's dishonesty and theft, it can be really hard on my end.
Yes.
How to just stay in the present moment and keep that bond, just that heart-to-heart bond and remembering who really are before they were so unwell.
Yeah, it is so challenging. I understand that you feel pulled in two directions for your love for them, but also for your safety for yourself. And I can see that obviously you're still tormented, even though this happened 8 years ago. You're coming here to talk to me about it. I hope I can give you some solace. I believe you did the right thing. I believe it was either you survive or he survive. And you chose you. And it's never the wrong thing to do to choose you. You can never implicate yourself or shame yourself for loving yourself and for putting yourself first. And you did the right thing. And I mean, my words are just words. You have to really internalize them and embody them, embrace them and integrate them. But you did what, perhaps more than anyone could have done. It is hard because your mind keeps going back. But I will just encourage you that going back in time is never going to be productive or helpful or useful or healthy. Try to stay in the moment. And you can write him a letter right now and say, I'm so sorry if that hurt you, but I had no choice and I'm here to love you. The only condition is that you are in treatment. So you are willing to love them, but they have to go to treatment. So there's nothing wrong you did. He was an adult at that time, but I can understand that your mind simply cannot let it go. But in not letting it go, you are not facing reality. You're living in a different reality and you're suffering. So what is the point of going back into the past except to make you suffer?
Well, thank you. And I will say that, deep in my soul, I really did feel that I had to do that, exactly that. My life mattered as well. If I'm not going to be well, how can I help him or anybody? I had a willingness about my own life to be good and to care for it. And just your affirmation means a lot. And for anybody else who's in my shoes, it really does feel clear when you can really connect with yourself. It feels really clear. And I really had done everything. I had that no regret. If anything, I had waited a little bit too long.
And that's the thing. See, you didn't create the addiction in him. You couldn't have created the addiction in him. And sometimes we blame ourselves and our parenting, but nobody can create an addict. An addict is coming from his own or her own disease. It's just like, would you blame yourself if your child got cancer? You wouldn't, because you would understand it's their unique genetics and epigenetics, and you're here to support them. In the same way, you did not create an addiction in your son. No amount of bad parenting can do that, because many times worse parenting doesn't create an addiction. So we know it's not an absolute causation, bad parenting, addiction. We know that there could be some correlation, but there are millions of parents who did a worse job than you and don't have addicts for children. So you need to release that shame and guilt and realize that this would have happened even if you did not yell at him on that day and gave him the toy on the other day. You can't beat yourself for this. I know it's easy for me to say, but addiction is a deadly disease. It's a disease of the mind and the body. You are not God. You did not create this. You are not the, architect of your child's neurochemistry. And you did the best you could. And after a point, actually, if had you allowed him to keep abusing you, you would have been an enabler.
Yes.
So the greatest gift you've given your son is to stop enabling him.
Again, in my heart, just to hear your voice, hear that external kind of affirmation. And that is what happened the second time when I took him in. It was worse. He was able to blame me more. I was already changing. So all of that really resonates. And you really hit the nail on the head too a few moments ago when you said it feels like a conundrum, to go toward the person that you're so bonded with. That doesn't go away.
Right. So your bond to go toward him, your connection to go toward him is clear and strong. But if you know that your presence is going to actually harm that person, then you don't go toward them, right? So in an addiction case, the parent going to help is actually the worst thing for that addict. It's enabling. So in this case, it's the opposite. And that's so hard for a parent because all you want to do is rescue. But in this case, it is actually the toxin. It's not the antidote.
Yeah. That's, again, it's so great to hear you say this because I started to gather this, wisdom inside myself that there was ways it was only making it worse. My life was getting worse. And just more time together was actually worse. So that's such a great affirmation. And again, when the bond that makes you want to go toward, then to really, really listen to that wisdom. And that was some of the gift, the gift within this nightmare was to be able to hear that voice and trust it. And if I start to lose my own life force, I can't help him or anybody.
Exactly. And just remember, whenever you feel guilty that you should do more, you should help more, you should be there more, remember that in the case of substance abuse addiction, that is actually the toxin, not the antidote. Just keep that in mind every time that feeling comes up, that surge of maternal love and care. Go plant a garden, go on a walk, take care of yourself, go take care of some little children, an orphanage, harness your care in other ways because actually you will poison him more because what he needs is not more love from his mother. What he needs is more love for himself. And actually the mother's love will create a distraction because he'll just start blaming you. He'll start dumping on you. So you are doing the right thing. And I hope these words will stay with you and you will finally let go of the past and enter the present moment.
Yeah, that is so helpful. In fact, again, it's such an affirmation of what I was already kind of bringing into my own wisdom. And there's peacefulness in it because that's what's real.
Well, I'm so happy. Thank you for sharing your story. Thank you for trusting me to give you some solace. And good luck, really. And I hope you start living your life beautifully now.
Thank you.
Oh my goodness, my heart was breaking for this mother because I could see how much she was struggling to deal with the reality of her existence. Much of parenting is coming to terms with the fact that the fantasies we had about our life as parents or our children doesn't match the reality. And that adjustment between fantasy and reality is just often a hard reckoning, especially if your child is suffering with an addiction or going through some huge emotional crisis. So in each case situation, in each scenario, it's a different approach. As you saw with this mother, we have to understand the nature of addiction. We have to understand what is enabling and tailor our approach in a very specific way. But this is why I advocate to all parents constantly, get the help you need. It's hard to be vulnerable and seek advice and guidance from experts, but it is so important. Don't suffer in silence. I'm so proud of this mother for reaching out to us here because she needed the solace of my affirmation. And even though it's 8 years later, I was so grateful that she was brave enough to seek it. And it's my hope that she will embrace and embody what I told her. But if you're out there suffering and feeling alone, go get help. It's okay to be vulnerable. Sometimes the expert, the coach, the therapist will have just the right thing that can help you. And, I have a coaching institute. I have so many amazing coaches that can help you, can support you on this often maddening journey called parenting. And this is why I've really created my conscious community, because I saw how terrifyingly isolating it is to be a parent, to be a human in today's world. So I created my community called the Conscious Circle. Join it for less than $25 a month. You may meet other parents. So, for example, this mother could meet with other parents who are suffering with the same struggles with children who are addicted. We need a network of support. We need each other in this increasingly isolating world. So check out my community. It's called the Conscious Circle. You'll get workshops, input, insights, guidance from me and my team every single week. I hope you take this to heart and at least explore my community. And once again, thank you so much for listening to this episode. I hope I see you on the next episode of Parenting and You with me, Dr. Shefali. Parenting and You with Dr. Shefali is for educational and informational purposes only. It is not intended as a substitute for professional medical, psychological, psychotherapeutic, coaching, healthcare, or other qualified professional advice, diagnosis, or treatment.